For this meeting has begun.
Hello, everybody. My name is Jonah Begay with the Telopea Behavioral Health Center of Excellence, and this is the MSPI DBPI Projects webinar, Project Year 2. And before we turn things over to our presenters, I'm going to go ahead and do a quick orientation to the layout that we have for this webinar. Right here, we do have the sign-in just right here. The two links are the same, so if you haven't done so already, please click on that and sign in your attendance. There is going to be a question in the very beginning that doesn't really apply for this group, so you can just go ahead and click Other, and then you can leave that portion blank. Over here is the clinical questions and comments. This is for questions and comments pertaining to the webinar itself. And then right below that is technical assistance. If you're having trouble connecting your audio, you're not hearing the audio very well, or maybe you're not seeing the slides very well, please let us know in that chat box right there. Joining us in the background is Elena George and Mary Toledo, also with the Telopea Behavioral Health Center of Excellence, and we'll try to help you out as best we can. Down in the very lower right-hand corner of the screen is today's presentation in a PDF format. You can download that at any time by clicking on the title itself. The title will highlight blue. From there, at the bottom, the Download Files button will become active. You can want to click on that. And then from there, it'll take you to a new window or a new tab, and you can follow the prompts from there. So again, if you haven't signed in for your attendance, please do so right now. The first question doesn't really pertain to this group, so you can just select Other and leave that portion blank. If it doesn't let you move on beyond that, go ahead and just type in NA for not applicable. And with that in mind, I'm going to go and turn things over to Audrey.
Great. Thank you so much, Jonah. So thank you, everybody, for joining today's webinar. Just as a reminder, this is the Welcome Back webinar for all the MSPI and DBPI projects. Those of you who were funded in 2015, so this is your Welcome Back webinar for Project Year 2. Again, just to quickly introduce myself, my name is Audrey Solomon. I am the MSPI National Program Coordinator, and I am based in the Division of Behavioral Health at the Indian Health Service. And I will be conducting the first portion of today's webinar, and then about midway through the slides, I will turn it over to Selena Karaiti, who is the DBPI National Program Coordinator in the Division of Behavioral Health. So we will go ahead and get started. I wanted to give you, first of all, just a quick agenda of the topics we're going to cover today. I'm going to cover some brief background, and I'm going to go over some housekeeping items for both MSPI and DBPI. I'm going to talk a little bit about official communication, who you should be reaching out to and who those individuals are. Then I'll turn it over to Selena with what to expect in Project Year 2. She's going to go over some more details about what you should expect to be seeing as we move forward throughout Year 2. She will also talk about the technical assistance providers for evaluation, and then Selena and I will both be available for questions. We're hoping for about 5 to 10 minutes at the end of this 30-minute Welcome Back webinar. So again, I'm going to cover just some brief background to start off. For both MSPI and DBPI, both of these funding cycles are either a grant award process or a federal program award process. For the grant award process, those of you who have received a grant are referred to as grantees. And those of you who are IHS federal facilities, for example, IHS area offices, IHS hospitals, or IHS clinics, you have received federal program awards, and therefore you're not referred to as a grantee, you're referred to as a federal program awardee. So I wanted to make sure to have that distinction up front, because you will notice throughout this webinar that we will reference either grantees or federal program awardees or both when referring to certain topics. For both MSPI and DBPI, there is a total of 5 years for this funding cycle that began when you were awarded in 2015 and will run through 2020. So right now we are currently in Project Year 2 with Project Year 2 starting September 30th, 2016 and running until September 29th, 2017. So for MSPI, this slide just gives you an overview of the number of projects that are funded in each purpose area. As you all know, there are for MSPI 4 purpose areas that you are able to be funded in. The number of projects is provided to you by each purpose area for a total number of projects funded for MSPI at 156, and that's quite a bit. So there are a lot of you who are attending today's webinar just for MSPI alone for your project, over 156 projects total. Just to give you a reference point, annually, what that looks like in total funds awarded is just over $21 million, again, and that's annually. For DDPI, there are only 2 purpose areas. So again, the number of projects broken down there in this slide by purpose area for a total number of 57 projects, and a total amount of funds awarded is just under $7.6 million annually. Again, just to give you a reference point. So right now what I'm going to do is I'm going to talk a little bit about your official notice of award. And you should have received your official notice of award via email. For grantees, you would have received your official NOA from the IHS Division of Grants Management. And for those IHS federal facilities or federal awardees, you would have received your official notice of award from the IHS Division of Behavioral Health. I just wanted to also mention that if for whatever reason you did not receive your official notice of award, please feel free to reach out to your area project officer. They will be able to help you get in contact with either grants management or potentially help you locate that official notice of award. And I mention that only because we've had some folks tell us that they have not received that official notice of award for project year 2. In addition to the information is included in your notice of award, we wanted to point out some special sections for you. There are special terms and conditions that are listed in your NOA, and those are either your standard grant conditions specific to grantees that would include information on your deadlines, who to contact, who your grants management specialist is for your particular grant. It gives you information in there as well about federal regulations, cost principles, audit requirements, things that are very specific to your grant within the Division of Grants Management. I also wanted to point out that there's a section that's specific to programmatic terms and conditions, and this is true for both grantees and IHS federal awardees or federal programs. Now, this information is programmatically specific, and these are the programmatic specific requirements that we want to make sure that you reference throughout, not only in the beginning of when you are awarded, but throughout the duration of your grant or program award. Information in this section includes your required reporting information, annual progress reports, financial reports, the deadlines when those reports are due. It indicates when additional required documents, such as your brief project overview, which for you guys in your case, you would have submitted that brief project overview at the beginning of year 1. It includes information about your continuation application, the kickoff meeting, and required participation in either technical assistance calls or in national evaluation pieces. And again, also when to notify the appropriate entity of any personnel changes that you might have. And again, we just want to point out that we ask you guys to please review this information very, very carefully and go over it in detail every time you are issued a notice of award for your grant or federal program award. So the next section I'm going to go into is the communication section. I'm going to cover the different areas of I'm going to cover the different entities that you will reach out to in terms of official communication for your grant or federal award. So the first piece of information I wanted to go over is for your IHS program officials. As I mentioned at the beginning of this webinar, I am located in the Division of Behavioral Health as the MSPI National Program Coordinator. I also serve as the MSPI Program Official for your grant or your federal program award. So I would be the individual you would contact for any national programmatic inquiries that you would have. Similar to my role for DDPI, Selena Caridi serves as the DDPI program official. And again, our information is listed in the official notice of award that you would have received. Our emails are also located on this slide. And you should always feel free to contact either one of us if you have questions. But in addition to us being available to answer your questions, you all should also know that you have an assigned area project officer who is able to provide you with guidance on your project activities, your budget, and basically provide you with general technical assistance throughout this entire funding cycle. An important point to note is that your area project officer or APO serves as your first line of contact for all of your questions that are related to your scope of work, your activities, in some cases your budget and your budget narrative. And if you just have general inquiries about the process, you should always look to your area project officer for those initial questions. Keep in mind that your area project officer, if for some reason they can't answer your question, they will also reach out to either myself for MSPI or Selena for DDPI to help you get the information you need. So please keep that in mind as well. So the area project officers, as we hope that you already know who your area project officer is, but if for some reason you don't, this slide gives a breakdown of who the area project officer is by IHS area and also provides you with their email contact information. This slide is just a point of reference for everybody, and you definitely feel free to keep the slide handy for any time that you might want to quickly reference the email for your area project officer. And the next set of communication information I'm going to talk about is for the grants management specialists. Now the grants management specialists, or the GMS, those folks are located in the IHS Division of Grants Management. And those gentlemen are listed here for both MSPI and for DDPI. So if you recall, for MSPI, we have 156 projects that are funded. So with that large number of projects, we have 2 grants management specialists that split up the technical assistance piece for the Division of Grants Management. So Donald Gooding and Willis Grant, they cover certain projects for MSPI. They're assigned certain projects by grant number. And here, where you see me pointing this green arrow, the information in this box, this link here, is specifically for MSPI. So in order to identify, if you haven't already, your grants management specialist, you can click on this link and make sure to have your grant number handy for MSPI. You can identify whether Donald Gooding or Willis Grant is your grants management specialist. So hopefully that will help you if you don't already know who your GMS is. And because there are a fewer number of projects awarded for DDPI, you have only one GMS contact, and that individual is Mr. Andrew Diggs. And so in this last slide on official communication, we just wanted to make sure to go over some important pieces regarding official communication. So for grantees, your official contacts are listed in your official notice of award. as either the project director or the author or the authorizing official. So as you probably come to find out in the last year or so, these two individuals that are listed as either the PD or the AO are the individuals who will receive all official communication from the Division of Grants Management. That's not to say that those individuals, if you have staffing changes, can't be changed. So if you do have changes to either any one of those official contacts, you would need to contact your grants management specialist, and they will give you guidance on how you can make that official change within the Division of Grants Management. For federal awardees, your official contacts are those individuals you would have listed in your continuation application submission. So just keep in mind that if those do change as well for you, we ask that not only do you notify your area project officer, you also reach out to Ms. Shelley Carter at the Division of Behavioral Health. Her email is located here on the slide. She will process any official changes in your contact information for federal awardees only. Please keep in mind as a grantee, don't email Shelley Carter with your changes in official contacts. As a grantee, we ask that you contact your grants management specialist so they can process those requests. So right now I'm going to go ahead and turn the rest of this webinar over to Selena Coretti, who is the DDPI National Program Coordinator. Selena?
Good afternoon. This is Selena Coretti, and I am the DDPI National Coordinator for Division of Behavioral Health. I will go over what to expect in year 2 for projects. They are going to be required reporting, MSPI, DDPI data portals, and in-person MSPI, DDPI project meetings. The Federal Financial Report, also known as the SF-425, is a financial document that shows transactions of the grantee's federal cash, expenditures, and unobligated balances. Each grantee and federal awardee is responsible for submitting this document. The reporting period and due dates are listed in the Notice of Award. I'll show you an example of the submission chart in the next slide. Earlier, Audrey alluded to the Notice of Award, which is also part of the programmatic activities, and she talked about that a little bit. The submission of the financial reports are different for grantees versus federal awardees. Grantees need to upload their SF-425 and also payment management system in Grant Solutions. For the federal awardees, the SF-425 needs to be uploaded in the MSPI and DDPI data portal. Sorry. So here is a point of reference. That is a chart displaying the submission of the SF-425 by calendar year, project year, quarter, and the actual due date for each quarter. As you can see, quarter 1 is due on January 31st, which is today. Each quarter is color-coded by month and is associated with the due date. For example, notice in quarter 1 is highlighted in blue, and the due date is in blue as well, and that's on the left side. And also for the subsequent quarter 2, you'll see it's highlighted in purple, and the due date for that is April 30th. So this is actually a really good reference point to keep because of the due dates for the SF-425. Specifically for grantees, submit the SF-425 to submit the financial report to the Payment Management Report in Grant Solutions. Please note all grantees are required to draw down funds from Payment Management System. Something also very important to remember, each project will need to connect with your tribal or tribal organization's finance office to ensure the financial person has access to the Payment Management System and Grant Solutions. If your finance person does not have access, now is the time to make those connections and obtain access needed. For federal awardees, you will need to submit your SF-425 to the MSPI and DDPI data portals. Very important, all of the federal awardees should have access to the MSPI and DVPI data portals. If you do not have access, then please inform your area project officer immediately so that she or he may assist you in obtaining access. So this is for the federal awardees. Program office will be working on the continuing application kit, and there will be communication about the process and the guidance in the near future. In order to receive funds for year 3, each grantee and federal awardees will need to submit the continuation application kit. Further guidance will be provided to all projects from your project area officer. For grantees, continuation application kits will need to be submitted in Grant Solutions. Official email notification from DG&M will be provided. For federal awardees, submissions will be done by via email. There will be an official email notification from DBH staff about the continuation application, so stay tuned for that information. Again, just as a reminder, the continuation application kit will need to be submitted into the MSPI and DVPI data portals. This is only for federal awardees. Annual progress report. For those that are new to the projects for both MSPI and DVPI, and for those that are already familiar with the project, it is a requirement to submit the annual progress report. The grantees and federal awardees just completed these reports for year 1. Currently, we are in year 2, and the reporting for year 2 is indicated on the slide. Grantees will report their data elements for the annual progress report into MSPI and DVPI data portals, and also the SF425 will be uploaded in Grant Solution along with a copy of the APR that is extracted from the data portals. For federal awardees, they will upload their data elements for the annual progress report into both MSPI and DVPI data portals and along with their SF425, not in Grant Solution. The data portals are open for both MSPI and DVPI. If there are corrections to be made that need to be made for year 1, now's the time. It is important to fill out all the data elements in the data portals. There are sections for both quantitative and qualitative data in the portals. So for the grant administrators who are project director or program coordinator should have access to the data portals. If you do not have access or have questions, please contact your respective area project officers. And Stephen Whitehorn is the point of contact for access to the data portal, and his email is listed below. In-person meeting for all projects. Similar to the Denver meeting, Division of Behavioral Health is planning a meeting for grantees in August 2017. A specific date and location is still yet to be determined at this point. We will provide more information as we find out. All of the projects should have travel budget for this in-person meeting for the project director and or coordinator. At this meeting, we will cover project implementation, planning, reporting, requirements, and data portals overviews. In this section, I will talk about TA providers for evaluation, what should I be working on with my TA provider for evaluation, and the contact information. I'll give a short update on the evaluation piece and in the subsequent slides. The TA providers will provide technical assistance needed for the grantees and federal awardees. They are your point of contact for all evaluation questions on how to collect data. The National Indian Health Board and also the Council of Urban Indian Health no longer provide TA evaluation for both MSPI and DVPI, and this is for all purpose areas. So it's something to note and keep in mind. The point of contact list for the for the technical assistant providers was updated in the IHS website. Here are the links for both MSPI and DVPI. Tribal and urban epidemiology centers are available to provide the TA assistance for evaluation for all MSPI and DVPI purpose areas. So what should I be working on with my TA provider for evaluation? Your plans for gathering local data is what you will be working on with your TA provider. I'm going to give some examples for DVPI and MSPI as the local data collection plan. These are just examples. I don't have slides for that, but I'm going to just talk about this. So looking at some of the applications, there are plans in place for the local data collection plans. The applicants describe how they will gather data, submit data requirements, and ensure the data is accurate and how it will be tracked. So if you look at your application, you will see that section in there. Each of the projects have various purpose areas with diverse activities. This is the reason why it's important for the grantee or fellow awardees to work with their TA providers closely for their respective tribal epicenter. So I'm going to talk a little bit about the DVP, an example of a DVPI project. A grantee may have an activity for an activity for an intimate partner violence, domestic violence. So I'm going to say IPV and DV for intimate partner violence and domestic violence. So the grantee will be tracking perhaps maybe number of patients with IPV/DV educational counseling, number of staff trained and screening for IPV, DV provided. And then if you look at their objective, it may say promote community education for adults and youth on domestic and sexual violence. And they will be looking at number of trainings, number of attendees, and types of trainings. And I'm going to talk a little bit about the MSPI project. They might be implementing a dialectal behavioral therapy. The grantee will be looking at indicators such as number of staff trained for the treatment modality of the dialectal behavioral therapy, number of patients served with that modality that can be broken down by various categories such as child, adolescent, adult, and by age. Specifically for Purpose Area 4, it will be broken down by adults and youth under age 24. So again, this is the reason why it's really important that you work with your TA providers to get that technical assistance from them, because they are the experts and they're the ones that are supposed to be helping you guys. As you work with your evaluation, what you guys are going to be looking at is the goals, the objectives, and the activities written in your application for year 1 and year 2. Look at the data plan written in your project plan and work with your regional tech providers to provide the technical assistance needed. The TA providers have access to each of the projects in in a system called max.gov for year 1 and year 2 grant applications, so they can assist you with developing the local data collection plans. So something also important to note, please note the tribal epicenters do not serve as the evaluator. They provide technical assistance on the evaluation for activities planned in the project narrative. Where can I find all this information? Materials covered for this webinar can be found at the following website. And the contact information is myself, as Audrey mentioned. As always, thank you. And we will take questions now.
So thank you, Selena. So we've been both Selena and myself have been trying to answer some of the questions in the chat box as folks have been typing them in, and I think we're pretty caught up. I can see that there are some other individuals typing questions into the chat box, but I want to answer Micah's question The question is, if we have a first-year supplement funding, do we submit under our initial MSPI funding quarterly report or two separate reports? And Micah, just to clarify, you're referring to your additional MSPI award in 2016, is that correct? So I'll let Micah respond to that. Okay. So Micah, what you'll do is you'll actually combine those funds. If you were awarded in 2015 for Purpose Area 4 and you received a supplement for Purpose Area 4, MSPI Purpose Area 4, you're going to combine those funds for Purpose Area 4. Now, Micah, if you received, for example, an award for MSPI Purpose Area 1 and then received a supplement award for in 2016 for MSPI Purpose Area 2, you would submit those financial documents separately because they're for two separate MSPI purpose areas. Is that helpful? So we'll, right, okay, great. Thanks, Micah. The next question is where and when is the MSPI meeting or the MSPI and DDPI in-person meeting in August and who is supposed to attend? If you go back to that slide that Selena covered, right now we only know tentatively that it will take place in August. We do not have a specific date or a specific location. So please just keep that in mind. Obviously, if we have that information at this time, we would let you know. We will let you know as soon as we have that information so you can start making travel arrangements. We understand that a lot of you are in a space where you need to submit travel as soon as possible, and we're working really hard to make sure you get that info ASAP. And regarding who is supposed to attend, in your notice of award under the programmatic terms and conditions, we ask that either your project coordinator, that person who does the on-site day-to-day oversight for your MSPI or DDPI project, that they attend. If for some reason they can't attend, your project director should be the individual who might attend. In some cases, if you budgeted enough money, both of those individuals would be able to attend that in-person meeting. The next question, do we contact our evaluator or will they check in with us? And that's Bertha Brown. Bertha, just to clarify, the TA providers for evaluation, those tribal epidemiology centers, are not your evaluator. They're your technical assistance provider for evaluation. So you are welcome to reach out to them directly. I believe on that slide there was a link to the pages where you can find your TA provider for evaluation contact information. They also, I know that they've also been reaching out to various projects, but Bertha, if for some reason you haven't heard from them, I would definitely email them or call them and check in with them, okay? And the next question is specific to evaluation. Selena, do you want to take that one?
Yes, I'll go ahead and take that one. So it says, can you please clarify what is required regarding evaluation? We never really heard anything from NIHB. We are collecting data with our current TA, but is there an evaluation plan or component? So again, I gave specific examples about the MSPI and DDPI in terms of data collection. You know, with the local data collection for evaluation, the activities are so different and, diverse. So you really need to work with your technical assistance provider about how to implement that or how to develop that evaluation plan. So again, as I mentioned, you have to really look at your goals, what's written in your project narrative, your goals, your objectives, and activities in your grant application for both year 1 and year 2, and look at the data plan written in your project plan and work with your TA regional technical assistant. And if you look at that application, that will kind of help you drive on and develop your local data collection plan. I hope this is helpful.
So again, I think if you guys have questions that are specific to the evaluation portion, please know that you know, the Division of Behavioral Health is working now to finalize the National Evaluation Plans, and you guys will be hearing more information about that from DVH soon as we're able to do that. And as I understand your concern regarding when NIHB was involved and you never had any guidance from them regarding that piece, but that's only because we're still in the process of finalizing that information. So I hope that information that Selena provided to you is helpful. And Christopher, I'm sorry that you're having some technical difficulties with the Adobe Connect, this Adobe Connect session. Please know that this webinar is being recorded, so you'll be able to watch those portions that you have missed during this session. And again, we apologize for that. Sometimes the connections can be a little difficult for some folks, but we're glad you're able to listen to and get portions of it. So what Selena and I will do now, it's about 1:36. There is another webinar scheduled in the next 14 minutes or so specifically for MSPI Purpose Area 4, the newly awarded grantees. So what we're going to do is we're going to take a couple of last few questions, and then we're going to go ahead and close this webinar out. Please know that if we didn't get to your questions today, we will do our best to reach out to you individually. Keep in mind that what would be really helpful for us is if you would email your questions directly to us. Keep in mind, again, here's our contact information, that Selena and I, we oversee MSPI and DDPI programs respectively. So please address your questions specifically to the national coordinator that oversees either MSPI or DDPI, and we will do our best to get the questions answered via email to you. We understand that there wasn't a lot of time for questions today, so we welcome your emails or phone calls to answer your questions. So one of the last questions we will take, Danielle, your question with the proposed federal cuts, how secure the MSPI and DDPI future funding streams. Danielle, we are, of course, as you know, we're also still learning about learning more information on the changes that are coming down within the federal government. Right now, we don't have that information, and we can't speak to that information at this point. If we receive any guidance on that, we will absolutely let everybody know as soon as we know. Right now, we're still also waiting for that information as well. Okay. And the last question we'll take is from Marcita. In terms of the location for the MSPI grantee meeting, may I suggest utilizing a webinar type of meeting? I would rather spend our funds on services to our people. And Marcita, I understand that, and I very much understand your concern about wanting to utilize all the funds specifically to programmatic activities. In your notice of award, we did let everybody know that the in-person meeting is a requirement for your grant and or your federal program award. So Marcita, if you'd like to speak with either myself or Selena offline about the specifics of the requirements for that particular activity, we'd be happy to talk to you about that in more detail, okay? And again, we want to thank everybody for participating on today's webinar. We welcome your comments, your suggestions, and your questions regarding the topics that we covered today. Please feel free to email or call Selena or myself. And don't forget that if you joined a little late, the slides are available to download here in the files box in the bottom right-hand corner of this webinar today. We also do want to acknowledge that there were at least a couple of errors on some of the slides that we presented today. Please know that those will get fixed when the recording and the PowerPoint slides are available on the MSPI and DDPI web pages by the end of this week, okay? So again, thank you everybody, and if you are not an MSPI Purpose Area 4 new 2016 supplement or new awardee, you can go ahead and log off this webinar. Thank you so much for joining everybody, and you have a good rest of the day.